Good morning and welcome to Meet the Experts. My name is Amanda Pearson. I'm a patient and family specialist in the Patient Library and Welcome Center. We present these sessions each Tuesday and Wednesday at 10 a.m. And today's topic is on medication safety matters. Speak up for your health. Before we get started, we have a quick disclaimer. The content in this presentation is not intended to be medical advice, and the viewer should consult their physician should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. And if you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information contained in this presentation. Additionally, today's session is being recorded. We have turned off all cameras and muted microphones to better protect your privacy. If you have any questions, please use the Q&A tab or type your question to our expert in the chat. And now it's my pleasure to introduce our speaker today, Lisa Booth, Regulatory and Accreditation Safety Specialist here at Moffitt. So I'd like to welcome Lisa.
Thank you, Amanda. I'm so glad to be here. And I love speaking on this topic because medication safety does matter. And whether you're a patient or you're a patient advocate for a loved one or a friend, I've been in that position. We've all been in that position. And we all need just general advice on the safety of medications, because in the long run, it's going to make us healthier individuals, and it's going to allow us to help those we love as well as ourselves. So, medication safety is a team effort. So, the team is you, your doctor, the pharmacist, and other caregivers. And the mission is medication safety. And the plan is to speak up about your medication and make certain that you have the right medication, the correct dose, and that you avoid bad reactions. And it's important to know what questions to ask so you feel comfortable speaking up about a new medication, and to speak up if something doesn't sound right. So often when we're at an appointment or we're in the hospital, we are overwhelmed with information, and we don't think to ask at that specific time. So if you don't ask at that time, number one, if you have somebody with you, they can ask the question for you on your behalf. Or number two, you can, if you're in the hospital, ask your nurse to please give you information or contact the provider. Or if you're at home, you can call your provider as well as call the pharmacist of the pharmacy where you're receiving medications. Pharmacists are a great source of information on medication. Okay, so the number one priority to do for medication safety is create a medication list. And you want to make sure wherever you decide to create that list, whether it be on a piece of paper that you carry with you in your purse or wallet, or if you want to do that electronically on your iPhone. I personally have a list in my notes in my iPhone. You want that list to be with you so that any doctor's appointments or any unexpected events, if you have to be taken to an urgent care or an emergency room, you have that list readily available. And when you do go to your physician appointments, you want to share it with your doctor and pharmacist and other caregivers. Your list should include prescription medications, as well as over-the-counter medications, vitamins and other supplements, herbs, and natural remedies. Sometimes if we take over-the-counter medicines, we think that we do not need to include that on our list, but we definitely need to, because those medicines can react with our prescribed medications. So it's very important that healthcare providers know what medications, whether they are prescription or over-the-counter, that you routinely take. So tips for ensuring effective, safe medication management. Understand each medication's purpose and effects. And that's where these questions come in. When a provider tells you they're going to prescribe you a medication and they explain it, if you don't have enough knowledge, ask questions. How will this affect me? Why are you giving me this medication? And what side effects does this medication have? And you should develop a medication schedule outlining when each medication should be given. If you're on more than one medication, especially, it gets complicated. The use of pill organizers, I find that to be very helpful as a patient myself, as well as an advocate for friends and family. Set reminders to take medications on time, whether it be an alarm on your phone or another reminder to ensure that you're taking your medications. Use a single pharmacy if possible. And this is so important because then that pharmacy has your medication history record. They can tell what medications you've been prescribed in the past and what medications you're currently on. So they can also be a double check for interactions between those medications. And I know that sometimes this is difficult to do. At times you may find, oh, I want to switch pharmacies for one medication because I can get it at another pharmacy for less expensive. And I've even done that myself. But I've come to realize if that expense is not too much more, and I have to add another pharmacy to deal with, as well as to pick up medications, the efficiency of sticking with one pharmacy as well as safety outweighs maybe a $5 more expense. Now, if it's much more than that, I understand that, but just some things to consider when you are selecting a pharmacy, that it's good to stick with a single pharmacy if possible. Communicate with your healthcare team any questions you have on your medications, whether you think of them when you're with your healthcare team or you recall the questions afterwards and you call in and leave a message for them. Be honest with your healthcare team about adherence with taking your prescribed medications. I know the feeling of telling a healthcare provider, I didn't really take that med. I didn't think I needed it. My blood pressure seems to be doing better. It's so important that they know that. So be upfront with them. Plan ahead for travel to ensure you have enough supply. We may have all been in this situation at one time or another, whether it's unexpected travel or planned travel. Think of your required medications and make sure you have that supply. And involve your trusted family members or friends if you need additional support. And we all need additional support as patients. Questions to ask your doctor about new medications. How will this medication help me? Are there any side effects? What are they? And how long will they last? Are there other medications or food I should avoid while taking this medication? Should I take this medication with food or before I go to bed? Will the medication cause drowsiness? What should I do if I miss a dose? This is always an important question to ask because some medications, they'll say, take the medication as soon as you realize you missed a dose. But with other medications that you're taking 3 or 4 times a day, it really is going to depend how long it's been since you missed the dose. So you may need to check with your provider or your pharmacist. Can I stop taking this medication as soon as I start feeling better? Or do I need to take it until it's all gone? What should I do if I cannot afford this medication? Other questions that you should ask about new medications. If the medication is a liquid, does it need to be shaken before use? If the medication is a pill or a capsule, do I need to swallow or chew it? Can I crush it if I need to? Is it safe to drink alcohol with this medication? And once again, pharmacists are an excellent source for medication advice. I reach out to a pharmacist just if I'm not feeling well, and whether it be I'm actually at the pharmacy or I call in to say, hey, I'm feeling achy, tired. Um, is there anything that you could recommend that I could take that's over the counter? Another good source, and once again, your first source is going to be your provider and pharmacist. But another good source, if you just want to read more about your medication and you don't have that education right in front of you, you can Google online at the medication and just make sure that it's a reputable source. And then you can read about some of the side effects as well as the intended effects of a certain medication. So, some general tips for medication safety. Learn about the medication you have been prescribed. Ask your doctor to include on the prescription why you are taking the medication. So, if he does that, if he or she does that, it will also be put on the medication label so that you don't have to recall. You'll see it on your label when you have the medication, when you get the medication from the pharmacy. And if you believe a medication was prescribed in error, call your pharmacist to ask if that prescription was filled correctly. If it was, contact your doctor. If you have any concerns. And if you're in the hospital, I can't um, enforce this strongly enough. If you are a patient in the hospital, I know at times it may feel intimidating to bother your nurse, but you are not bothering them. You have to speak up for your safety. If you speak up and they explain it and everything seems fine, then that's great. But if you don't speak up and there was an issue that somebody missed and it happens everywhere, then a medication error can occur. I've received medications from pharmacies that when I brought them home, I was like, wait a minute, I think this is double the dose that the doctor prescribed. So when I checked at one specific time, it was double the dose. So please, please, we have to be advocates for ourselves as well as for our friends and loved ones. Tips for medication safety while you're at the hospital. And those are make sure your caregivers check your wristband or ask your name before giving you a medication. That is a safety check. That is the last safety check before giving you the medication. Tell your nurse if you think you're about to get the wrong medication. Maybe it looks different than one you're used to. Tell your nurse if you're getting more medication than you normally take. Let your doctor know if you don't feel right after taking a medication. If you're not feeling up to doing these things, ask a friend or relative to help. It is so important to speak up for your safety. We need to be active participants in our care. Tips for storing medications. Store medications in a cool, dry place away from sunlight, in a cabinet or drawer. Make sure the child safety cap works and store it where children cannot get to it. Not all medication can be flushed down the toilet or thrown in the trash. So ask your pharmacist if you have any questions, how to dispose of unused medication, including syringes and other injectable devices. And find out if there is medication take-back program at your local pharmacy or police station. And once again, this is also information that you can easily find on the internet if you Google that, if you're not sure exactly where your take-back medication program is. Once again, medication and your health matter. So if you have doubts about a medication, have questions, or experiencing any side effects or reactions that concern you, don't hesitate to ask your doctor, pharmacist, or caregiver. Speak up about your medications. It's very important for your health.
Thank you for viewing this session. We offer live Meet the Expert sessions through Zoom. To see a full list of upcoming sessions, please visit moffitt.org/meettheexperts or call 813-745-1690.